Japan's government sends the average retiree about $600 a month from its public pension. America's government sends about $1,800. America pays 3 times more in nominal terms. But pensions do not pay for rent in a vacuum. They pay for rent in a specific country with a specific healthcare system and a specific cost for transportation. When you build the actual monthly budget for both, the gap between these two systems looks very different from the headline numbers. Japan's public pension operates on 2 tiers, the first of which is called Kokumine Nenkin, the national pension. Japanese residents contribute to it throughout their working years, with the full benefit becoming available at age 65. At that age, the monthly payout is about 68,000 yen. At current exchange rates, that converts to roughly $450 per month. The second tier is Kosei Nenkin, the employee's pension insurance. Workers in formal employment pay a share of their monthly salary into this program throughout their careers. The average total benefit for a retiree drawing from both programs is about 90,000 yen per month. At the current exchange rate, that comes to approximately $600. We will use that as our Japan baseline throughout this video. The United States bases Social Security on your 35 highest earning years, adjusted for wage growth. The average monthly benefit is approximately $1,800. We will use that as our American baseline. Both systems are mandatory. Neither was designed to fully replace a working income. But for tens of millions of retirees in both countries, the government pension is the primary or only source of monthly income. The question this video examines is what each amount actually covers when it arrives. Our Japan case study is a single retiree age 67 living in Osaka. They receive 90,000 yen per month from their combined pension. They are renting rather than owning, which keeps the comparison clean on both sides of this analysis. A small apartment in Osaka, outside the most central neighborhoods, typically runs about 60,000 yen per month. After rent, the retiree has 30,000 yen remaining for everything else. Food costs in Japan are where many assumptions break down. A single adult shopping at a standard supermarket spends about 25,000 yen per month, including several meals out each week at neighborhood restaurants. A set menu lunch at those places often costs less than 1,000 yen, less than $7. After rent and food, the budget has about 5,000 yen left. That is roughly $35. At this point, the math looks impossible. But Japan's healthcare system changes the equation in ways that do not appear in the pension number itself. Japan operates universal health insurance where retirees pay monthly premiums based on their income. At the pension income level, those premiums run about 5,000 yen per month. Most retirees in their 70s pay a 20% copay on medical costs as those costs occur. Beyond age 75, the copay drops further. Residents at that age pay only 10%. The practical effect is significant. A visit to a general practitioner in Japan costs a few hundred yen after the copay system applies. Consider a common prescription drug. In the United States, it might run $200. In Japan, after the copay applies, the same medication often costs under $15. Those savings do not appear in the pension amount. They are built into the system around it. Transportation adds another structural advantage. A monthly rail pass in Osaka runs about 4,000 yen. At current exchange rates, that is roughly $25. Car ownership is not required for most urban retirees in Japan, which eliminates one of the largest fixed costs in American retirement budgets. Japan also provides a separate long-term care insurance program called Kaigo Hoken. Retirees who need nursing support pay roughly 10% of those costs, with an income-based monthly cap. A care cost that would be catastrophic in many countries becomes a managed, bounded expense here. The spending adds up across categories. Housing consumes 60,000 yen, which is the single largest line item. Food and daily spending adds 25,000 more. Healthcare premiums account for 5,000 since retirees contribute based on their pension income. Transport runs about 4,000 yen per month for rail access across the city. Utilities, phone, and other basics bring in another 6,000, completing the picture. The monthly total reaches 100,000 yen. The pension provides 90,000 of that. Since the figures do not balance, the shortfall is 10,000 yen per month. At current exchange rates, the deficit runs about $65. Japan provides a supplemental welfare program called Seikatsu Hogo for retirees whose income falls below a regional minimum. About 1.6 million elderly people currently receive it. Many other retirees own their home outright, removing the rent expense entirely and converting the monthly math from a deficit to a surplus. Our American case study is a single retiree, age 67, living in a mid-size American city. They receive $1,800 per month from Social Security. Like our Osaka retiree, they are renting. The first challenge is housing. The national median rent for a compact apartment crossed $1,500 in recent data from Apartment List and Zillow. After rent, the retiree has $300 remaining for the entire month. Food for a single adult on a moderate budget runs about $350 per month, according to USDA cost of food data. That amount already exceeds what remains after rent. Then there is healthcare. Medicare does not cover everything. The standard Medicare Part B premium runs about $175 per month. Most retirees also carry Medigap supplemental insurance, which adds roughly $150 more. Prescription drug coverage under Medicare Part D adds another $100 on average. Monthly healthcare premiums typically exceed $400 before any deductible or copay applies, and that is before actually using any care. A specialist visit under Medicare carries a 20% cost share after meeting the annual deductible. Dental and vision coverage are largely excluded from standard Medicare entirely. Transportation is the third major structural cost. Most American cities were built around the car, and the transit infrastructure that enables car-free retirement in Japan simply does not exist in most of the United States. The American Automobile Association calculated the average annual cost of owning and operating a vehicle at close to $12,000 in recent years. A retiree with a paid-off used car still pays for insurance, fuel, maintenance, and registration. A conservative estimate for a frugal driver runs about $400 per month. Building the full monthly budget reveals the problem. Housing claims the largest share at $1,500. Food and daily groceries run about $350, based on USDA moderate cost spending data. Healthcare premiums total about $400 before any care is received. Transportation, since most mid-size American cities require a car to function, adds another $400 per month. Utilities and miscellaneous basics add about $150 more. The monthly total reaches $2,800. Social Security covers $1,800 of that. Since the pension and total spending do not match, the difference of $1,000 must come from somewhere else every month. To close that gap, American retirees draw on retirement savings plans, individual retirement accounts, part-time work, or family support. The Employee Benefit Research Institute found that 43% of retirees outspend their income in the first years after leaving work. Nearly 30% of Americans enter retirement with no savings at all. The math requires supplemental income every single month for the rest of a retiree's life. The nominal gap is $1,200 per month in America's favor. But the monthly deficit gap points the other direction. Japan's retiree runs a $65 monthly shortfall. For the American retiree, that deficit reaches $1,000 each month. The American system delivers 3 times more cash than Japan's pension, yet it leaves the American retiree facing far more financial pressure relative to their actual monthly cost of living. 3 structural cost differences explain the reversal. The first is housing. A small apartment in Osaka runs about 60,000 yen per month. At current exchange rates, that is about $400. The national median rent for a comparable apartment in the United States is $1,500. The American retiree pays more than 3 times as much for comparable shelter. The second is healthcare. Our Osaka retiree pays about 5,000 yen monthly in premiums and faces minimal co-pays throughout the year. At current exchange rates, that premium is under $40. Our American retiree pays over $400 monthly in premiums alone before receiving any care. The annual difference in healthcare cost between both cases exceeds $4,000. The third is transportation. A monthly rail pass in Osaka costs about 4,000 yen. At the current exchange rate, that is roughly $25. Owning and operating a car in America costs about $400 per month at minimum. The annual transportation gap between both cases approaches $4,500. When you combine these structural cost differences, the American retiree faces roughly $1,400 more in unavoidable monthly expenses than the Japanese retiree. Social Security's $1,200 nominal advantage does not fully close that structural gap. The OECD publishes purchasing power parity data for member countries. After the PPP adjustment, Japan's pension carries the effective buying power of roughly $720 when measured against American prices. The effective pension gap narrows. The deficit gap does not. To make this concrete, compare Osaka with Phoenix, Arizona. Both are mid-sized cities. An Osaka retiree covers roughly 93% of their calculated monthly expenses from the pension alone. A Phoenix retiree covers roughly 65% of their basic costs from Social Security. The Osaka retiree is closer to financial self-sufficiency despite receiving a fraction of the nominal monthly check. Neither system is designed to make retirement comfortable on its own, though each country has built different structures around its pension. Japan's system faces serious pressure. The birth rate hit a record low in recent years, and the ratio of active workers supporting each retiree is falling. It will continue to fall for at least another generation. The government bridges the gap through welfare supplements, community care programs, and employment incentives for older workers. That support network holds the system together today. Whether it holds through the next 3 decades is an open question. America's Social Security faces a different problem. The program's trust fund is projected to face a shortfall in the mid-2030s if Congress makes no changes. In that scenario, benefits could be reduced by roughly 23% across the board. The check that was already not enough would get smaller. What this comparison reveals is not which country has figured out retirement. It reveals that the pension amount is only one input in the retirement equation. The other inputs are where you live, what healthcare costs you, and what transportation demands of you. A retiree in rural Arkansas on $1,800 covers their expenses far more easily than a retiree in San Francisco on the same check. A retiree in Osaka on $600 covers their expenses more easily than a retiree renting in central Tokyo. Geography is a retirement planning variable that does not appear on any government benefit statement. The pension check is fixed. The cost of the world that check lands in is not. Choosing where to live within a pension system may be as important as the pension system itself. Neither country prints that guidance on the benefit statement. If this comparison was useful, subscribe. CashCinema runs this kind of simulation every week across different countries, income levels, and financial systems. Every video is free. No course, no product, no paywall. Hit the bell if you want the next one. Leave a comment if there is a country or system you want us to examine. Every dollar has a story.